Time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good day, everyone, and I am ecstatic for another day. And thank you for joining in, and thank you for taking time out of your busy schedule to join us today, which is very important. I want everyone to know if you are suffering from any conditions, not sleeping well at night, any autoimmune disorders, hypertension, diabetes, any medical conditions that you have been given a label on, keep in mind that this test, we're talking about the Oligoscan, which is more than just heavy metal testing. And I know we've had several shows on heavy metal. We're going into much deeper detail on the minerals and how your minerals are off balance because of heavy metal. So do you really have a deficiency in the minerals, or do you have a deficiency because of the pathway of what's happening with the heavy metals in your body? So this is a must listen to show. Please share this with everyone because you can turn around so many things in your body. We have so many people with anemias and not knowing iron and how it's connected to heavy metal and iron overload and too much calcium. I mean, my dear friend who wrote a book on death by calcium, Dr. Thomas Leetv, all these things we could check out. Do you have enough magnesium? That is the key. And this test, in 1 minute, less than a minute, you'll have the results. And we can go over that with you. So this is a must-see show and to share with your friends and family. And I am ecstatic about having my guests fly all the way to California to be in the studio in person, just to share this information. So keep in mind, please share this show with your friends and family because we have too many people suffering. A lot of the nutrients are not in the soil. So without further ado, Oligoscan, a 1 minute screening that can save your life, Oligoscan. So my guests today, I want you to introduce yourselves. I just had oral surgery, a 6-hour oral surgery. So I'm going to try to do a little less talking today. I wanted to make sure I was here. Please introduce yourselves.
Hello, my name is Elizabeth Fessler.
And I'm Michael Fessler.
Thank you so much. Now, all those wonderful people applauding for you. They're so happy you made it. And you both look so wonderful. And you're such a beautiful couple. The thing is, you're so vibrant. Look at you both. You're so vibrant. That tells me that you practice what you preach here. You do practice it. And the good thing about it, I like that both of you believe so heartedly in God. And when we're working with people this day, there's so many ill people, you must have a belief system here in order to heal as well. Because it's not just taking the supplements, it's not just taking the products. You got to go deeper so that you can truly heal. So I am so happy to have you both here, and you both look so vibrant for just getting off of a plane not long ago.
Thank you.
Thank you so very much. So we're going to jump right in because we've had several shows with you here talking about heavy metal, but we're going to go more deep involved with this so people will understand. So many people have had the tests at NuWellness Healthcare. Now I want you to take your test and kind of look as we go through the journey, explaining what all of this means. So I'm going to let you take it over from here. Thank you so much.
Let's start with when somebody gets a test on the Oligoscan, they need to know their blood type.
Number one, yes, they all meet me. They know that. Know their blood type.
Know their blood type. And
why is that important? I know you told me, but I want people to understand why is their blood type important?
Blood types have different proteins, and so when the algorithm on the spectrophotometer is looking at something, blood types show up differently on their concentrations. So some of the concentrations are outside, some people have more left or less. And so just like when you want to donate blood, they have to know your blood type so
Exactly.
it matches. So the same thing with the Oligoscan is that they need to separate out just like they have to separate the age, male or female, and all this plays a part to be able to measure the concentrations on the heavy metals and the minerals.
Right. Okay. Very good. And I know the right hand versus the left hand, the more dominant hand, is important too. And I always tell that to the patients, clients who come in, and they're always saying, which hand are you going to be testing, and then why?
Yeah, the non-dominant side is we retain more heavy metals, and we
Isn't that amazing?
most
Yeah.
medical doctors did not know that, but the Oligoscan is, and when you measure, and we've done this over and over on a doctor who says, well, I want to see the difference, and there is a difference, and we can tell who's left and right-handed just from these the higher levels of heavy metals
Yes.
on the non-dominant side. So the significance of that is the buildup on that side, and for women that could be a sign of something. So, and for anybody, the non-dominant side is usually where we find more inflammation.
Okay. And we have found some really interesting things, and people are becoming more aware. So without further ado, we're going to start going through a scan itself. And most people who have had their scans, pull them up on your phone, pull them up on your computer. If you had not had your scan, you'll at least have a copy of the show. The show will be archived on our YouTube channel, NuWellness TV with Dr. Lee. So please go to our YouTube channel, and you're able to follow along to understand, even though you will receive a consultation in the office. So let's move on right down this scan.
So when we run the scan, we have a module that reads 4 parts of the hand.
Yes.
It's non-invasive. It looks like this, and we read 1 second on each, and we read 4 parts of the palm.
Exactly.
And then,
So if you could see my hand, we go here, and I'm right at the camera there. So the 4 points, starting.
Yes.
And it shows you on the test.
it shows you on the Oligoscan.
Exactly on the Oligoscan, exactly where you're going. And this itself, actually, I call it a 1-minute test. It's actually 2 seconds. It's a 1 second test. So I didn't think people would believe me if I would say you can find out the results in 1 second. But it's actually, and it only takes a couple of seconds to really get a report. The consultation is what's going to take more time.
the consultation, the interpretation. Of what they're
Interpretation.
reading. And we have, when we train doctors and other practitioners, we ask them, bring your blood, saliva, hair analysis to make
Yes.
comparisons. And they're absolutely amazed how accurate this is.
It is, and I have done that too.
And so people start to really look at what's sequestered within their body, what's hiding.
Exactly.
And that's what we like to do.
And you know what I like to find, not to cut you off, but I did just a little bit, is that it's the root cause. Everybody talk about the root cause, but what is the root cause of the root cause? We have to look at, okay, here's the root cause of maybe some of your problems with the heavy metal and the minerals, because the minerals and the metals, they work together, and there's 4 top minerals that we have to make sure are in balance in our body. Even though we have over 20-some metals, there's 4 top ones in order to keep your body functioning well. All of them needs to be balanced, but there's some that are more crucial. So the root cause of the root cause is what the Oligoscan I find it to be.
Correct. And
Yes.
you can, I'm sure the audience can see how excited we are about.
Oh, yes.
I mean, when we are able to explain to somebody about their root problem and what made that,
Yes.
and how we can trace it out. In fact, the Oligoscan that we have in front of us, the first one that we'll look at is the sulfur. Is there sulfur excreting? Are they an excreter of non-heavy or heavy metals or a non-excreter?
Yes.
And in this particular test, on the second part of it, below the heavy metal test, there's a ratio that tells you whether you're blocked for the lack of sulfur conjugation. And this particular person's blocked 100%. So somewhere in his body, the lymphatics are being blocked. So no matter if you were to give them minerals or if you were to give them an IV, it may not go through the whole lymphatic system.
Exactly. And people, the lymphatic, we had a show and we talked about more even with you. Keep in mind, we have hundreds of lymphatics, of lymph nodes in our body. And as they're blocked, you're not getting the proper nutrition to the brain. You're not going to get it to the vision for your eyes. You're not going to get it for the thyroid. You're not going to get it for your internal organs in your abdomen. So there's lymph nodes everywhere. So you want to make sure those are not blocked. That's why I'm so happy that we're going to be talking about the products that you have as well that we can use on the body topically, so we can kind of eliminate so many pills all the time. But there's certain things we could do dietary too. But I love the product because you can just put it on the body to help that lymphatic system start to flow. So let me let you finish.
Well, when we see the ratio over 60%, we do start to look at the heavy metals first. And
yes.
Usually, when I see that, I want to see an element nobody's looking at, and it's called aluminum. And somebody will tell me, well, I don't use an antiperspirant.
Yes, I hear that a lot.
And around the world, the industrial world of making aluminum is emitting all around the surface of the earth, and we are breathing it in through our lungs. Mm-hmm. And the aluminum is actually creating a block within the skin. So what it doesn't allow, the sweating aspect of the skin is not, it's blocking like an antiperspirant. The whole skin is just holding onto the heavy metals.
Yes.
And that's why we're seeing a sulfur conjugation on many of these oligoscans. And that's the first thing we want to start looking at.
Right. I did the test on my grandson, and I know there's an age limit. Is 7 and up?
It is going to be lowering to 3 very
to
soon.
3 years old.
Correct.
He's 7 years old, and we were just amazed based on the area he's living in, which is an industrial area. His aluminum level was very high. Mm-hmm. Was very high, and his mother didn't use aluminum toothpaste and deodorant. We look at all that and we forget that it's in the atmosphere because of the industry and what's going on with our environment. So, and that's why his was so high.
What we do also, Dr. Lee, is we look at a person's diet, their cosmetics, where they live, and we start to separate out what we can eliminate, whether it's a breakfast cereal with sugar in it in the morning that might be contributing to it. There's many factors where we know sources of aluminum are coming from or other heavy metals. We know that, unfortunately, we talked about chocolate having high levels of cadmium and lead in it.
And we really only knew it for the magnesium. And now it's the lead and the cadmium. And people don't realize, and after going through the tests, and seeing some of the reports there and how the cadmium is linked to people having, I think it came up with cataracts. Yes.
Cadmium is in virtually all the tumors, when they cancer tumors, and it's in fillings for teeth, and it can vaporize all the time. So what we find with cadmium is you want to keep your zinc up, especially for a vegetarian, because when your cells start to lose the zinc, cadmium will take its place. So there's this counterbalance that when the heavy metals take place, it's harder to get the minerals in there. So we have to get the cadmium out, and that usually comes through the skin. That's the main part of the body it comes through. So the absence of sweating creates the buildup in the body. And that's what we're seeing in the Oligoscan. And everybody's asking, why am I seeing this big jump in heavy metals? So we'd like to start as soon as we can to start to show people how to detox. And so the next time they come in and get their scan, we can make even more improvement on their Oligoscan, and they will start to feel the difference in their body because these are not the aluminum and these heavy metal salts are not getting lodged in their lymph nodes in different parts of the body.
And what's really, really good with having the scan at my clinic is that when I test my cancer patients, We find the heavy metal, lead and mercury, but most important, in looking at the minerals with the zinc and the copper, because with cancer, if it's malignant, we don't want the copper level higher than the zinc level.
Correct.
And then we look at the IGF-1, and I know it's kind of, a word that most people don't hear, but the inflammation markers. So if your zinc is low, your inflammation markers are going to be higher. So in looking, and that's what I've been correlating a lot with as well. So looking at those inflammation markers, your C-reactive protein, your homeocysteine, look at all those with your heart. And I know we did my tests, and I had something that was unbeknownst to me that I just found out when I went to the dentist, and I went all the way to Tijuana. We're going to have them on the show later. And they did my EKG and told me somewhere down the line I had a mild heart attack. I'm like, what? So I'm looking at my EKG, and I know one day I was a little off, but the EMS that day, it was a lot going on and a lot of stress. But they said, you had a mild, look at your, it's old, but you had a mild heart attack. So, I said, oh, let me just make sure now I put more magnesium and do some other things so this doesn't happen. Because I know my father at age 65, he passed away from a massive heart attack, and I'm a couple of years older than my father when he passed away. So, making sure, number one, I take care of myself so I can help others. But I was so surprised to see that in the x-ray. This is just last Wednesday in an EKG. I'm like, oh my goodness. So I'm really curious because you did my test on your machine when we met you a year ago. So I'm curious to see what it's like now because I've been doing some things here.
And what's interesting is that when the cardiologist or they do an EKG, how is that done test? It's through the skin, correct?
Of course.
Okay, and so the Oligoscan is testing through the skin.
Through the skin.
So they're able to tell what's going with the heart just by what the cells are saying to this is not new science. This has been around. What they're not looking at, and unfortunately enough, is the magnesium levels on the with people who have a history or a family history. So the magnesium levels have to stay up, plus they have to detox more. But they're looking at the calcium scoring, but they're not looking at the fact that the high aluminum is binding with the calcium. So alumina has escaped the cardiologist, and that's and which the Oligoscan is correctly picking up. So when there's a lot of displacement of calcium, there's usually the intrusion of aluminum and the depletion of magnesium.
Yes, and I'm so happy you clarified that too. But I want us to get started with one of the tests because I don't want to run out of time because there's so much to this. So let's pull up someone's tests and let's get started.
And we have on the first test, if we're looking at the heavy metals, we've already looked at the blockage, so we know this person's blocked.
Well, let me just clear this up, because if a person's looking at this and they have not had it done, they're not going to know this line down the middle is your...
that's the optimum. That's the center.
That's your optimum.
The center of the range. So if you just look at one vitamin, if you want to mineral.
So if we go to the left with the left on the screen, where you see the highest red, that's high. And if you go to the opposite side, abnormal low. Correct. So you want to know abnormal low and abnormal high.
Correct.
You want to be in the middle.
Correct.
So the green that you see there is all pretty good on this person.
It's in range.
But the great thing about this is that you can click on to the high or low, and it will show you where is this coming from. Because a lot of people say, well, I don't know where it's coming from. I don't know why I have lead in my body. I'm living in an environment. I don't do this. Oh, I had mercury removed. I don't do aluminum deodorant.
Right.
They'll tell you all these things, not knowing that it's also linked to the metals. So right now we're speaking on the metals. So I'm going to let you go ahead and pull that up. And let's just kind of go behind the scenes and let them see that. And that's where your practitioner comes in. This is where I come in and do your consultation. But we can just show you a glimpse of it so we're not just pulling some rabbit out of a hat.
Yeah.
We're actually giving you true factual information.
This is what we like about the Oligoscan. It's a baseline for somebody.
Yes.
And then we have a starting point because when they come back in, we can overlap the Oligoscan and we can see what changes. If we have to intensify the detoxification.
Exactly.
If we have to improve the minerals, or actually we have seen people take calcium and see high calcium and it's not they're just wasting money, and in fact they're actually doing harm because now the calcium becomes toxic to the body.
Very toxic, very toxic.
Yeah.
And they have decreased magnesium. So let's start with the first one. Let's start with the first one that's normal and tell them that one's normal. Which one is that on the screen?
And we apologize for that. The normal, if we go to the minerals, we'll look at what would be normal here, and copper's normal, but the zinc is a little low. But I'm going to look at also the sodium potassium. I think the sodium potassium for me is really important. So see this person's low on sodium and potassium, but it looks normal.
Okay, let's put the arrow there because you have the pointers so people can see, because right now we have the matrix sort of abbreviation and might not know where you are. So
It's not going to show up there.
Yeah,
not going to show?
It's
Oh.
probably not going to show because it's when it has to be live on the screen for us to pull up. But we do know the
Okay.
the potassium and the sodium.
Tony, our master,
Did he was
he's
able?
here.
Well,
he
gosh.
can pull it
Okay.
up.
Okay.
So why don't we do this? Why don't we start at the top, even though it's normal, so people can go straight down?
Could I just interject something
Yes.
here? Because what we're going to do, first of all, is we're going to see individual norms, either highs or lows in the colors of green, yellow, and red.
Okay.
But we also have to look at the relationship, as you mentioned, zinc and copper, sodium, potassium.
We'll do that
So
last.
sometimes when you're seeing something, it will look like it's in range, and it is. But however, it's not functioning properly without its balance.
Will come. So the first one is the calcium, and that's in the normal range. The second one is magnesium. That's going towards low. It's in the yellow. And so we know that this person needs to bring up their magnesium. Everybody is low on magnesium because of aluminum. The next one, phosphorus. The phosphorus, when we see low phosphorus, it's usually the system is being blocked. And actually the body is utilizing all its phosphorus because it's not excreting. So it's a buildup of their phosphorus. So we found that to build up their phosphorus, actually, when you get them to sweat and detox, the phosphorus will start to come in and become normal again. Slowly. It's not, and when somebody says, how long will this take? Some people can take up to 5 years because these heavy metals, it's like taking sand out at the beach and it falls back in.
Exactly.
It's such an arduous task. After that, we have silicon, and then we have, that is usually low. That's horsetail. We usually have people take some sort of horsetail tea or a mineral with horsetail to pick up the silicon.
Now, are we able to go behind the scenes a little there to show? No?
I don't know if this is going to be visible
Okay.
because of this. It's on the program here.
Okay, so
But
go ahead.
When you look at if you look at the individual mineral as well as the metal, it will tell you, the very nice thing about the program is it tells you what the function of the mineral is. Then it gives you some sources, some dietary sources, and it also gives you some indicators that may tell you if there's something affecting your body as a result of your abnormal range.
Yes. And this is what we've been able to do. And the good thing about each one of those, it'll give you your symptoms or signs of high and low deficiency. And each one of those will tell you if it's high, if it's low, it's going to be linked to an autoimmune, each
Great.
one. So
We actually look at, there's 4 of the main things. Actually, there's magnesium, zinc, iodine, selenium, and sulfur are the 5 minerals that we look at. We have found that when people start a detoxification program, that those are the 5 minerals that will start to be depleted. Those
Okay.
are used in the transport heavy metals out of the body.
Okay. So let's keep going down that list and tell them all the ones on the minerals they're going to be. So you had phosphorus, and what was the next one?
That we have silicone. We had phosphorus, silicone. We got
Tell people what silicone, where is that found? Why would that be in someone's body?
well, that is usually the aluminum is depleting the silicon again and other heavy metals.
And why is it needed?
It's needed because it counterbalances the heavy metals, and it's part of the for the cells. It fits part of the working of the cell. It's like having a car with 12 cylinders. So you have to have all these to work in balance. And if you're losing a cylinder, you know the cells are going to get tired after.
Yes, they are.
And that's called inflammation.
Yeah, and that would be probably a little bit of your fibromyalgia in people who are chronic fatigue syndrome. So getting things balanced.
And we see these in different diseases or sicknesses. We will see these common things, but also we can be preventative, and we can break the genetic chain between our families that they didn't know about. So this is a real insight.
Yes, it is.
To the future of medicine. And so
and you know what's very interesting is to do an entire family. So if you do the entire family, the mother, the father, the children, or the significant other, maybe it's no children, and do both of them and see if they have the same pattern. Because if you have the same pattern, you're eating the same thing, and even though you might be working in two different places, something is still kind of happening there. And then start pinpointing some things.
And thank you, Dr. Lee, for bringing that up, because it reminds me of the fact that we are starting to see a correlation between parents who are called non-excretors for heavy metals that have a child that has ADHD or has autism. So the parents were low in iodine, they had heavy metals, and so they're non-excretors. So when the child's born, they don't have the they don't have the excretion process to be able. So we caution that they should be tested, and the vaccines may play a big role in that they're not able to excrete the vaccination.
But it's funny you're saying this, because I know of two children, well, actually more than two, that are slightly autistic, and they had no vaccinations. So now it goes back to the parent.
We need to, we pretty much like the parents to, or before they become parents.
Yes, before they become pregnant.
And we would like to see this go into the younger generation, so they're able to make changes in their life. Because if you have somebody with a lot of amalgams and a non-excretor and a lot of heavy metals, it actually makes the higher chances of that child not having the best that they can have.
Right.
So we like to clean up the young folks.
So then, what we'll talk about that later. What could be done with the child? But there's some things that I do as well. But
we a lot of people are now looking at how the avenue of autistic children, and they're finding detoxification. They're finding actually potassium and magnesium, and then there's a new one that suppositories of glutathione is starting to show, and this is going on in Europe right now. So they're getting
glutathione suppository. Yeah, that's amazing.
Yes.
I use glutathione in a nebulizer.
Well, we're talking in a different avenue.
Different avenue, I know. But I'm just wondering, since it's suppository, and I do know these children, the nebulizer, since I'll find out who sells the suppository. Yeah. But that's really interesting.
The nebulizer would be good for the pituitary gland.
It'd be good for the brain, yes.
The other part in the colon is that it would go right into the bloodstream.
Exactly. I'm so glad you brought that up. So I'm going to check more into that.
Yes.
Glutathione suppository. Because I know glutathione, I use it a lot for respiratory and COPD and other things too, and dementia. Yeah, because it goes right to the brain.
Yeah, we don't have time, but I do have that scan from Europe. And we are involved with our products topically, but the child was 70% sulfur blocked, and the child is now 20% blocked. So that's a big swing.
That's a big
with
swing.
all these. So it's not a linear approach. It's a multi-level approach to find all these things to counter what was found on the Oligoscan.
Yeah. And this is just, like I said, a 1 minute, no needles, pins, pins, no needles, no pain, and just a quick test. For you to get this valuable information, I think everybody should be trying to make sure you have this done. And that's definitely the baseline test so you know where you are. Let's keep going because there's a lot of information here.
Yeah, we're going to quickly go through it. We have the sodium and the potassium, the main things in a cell, followed by the copper and the zinc. Zinc is a very important part of the body. Iron, manganese, chromium. Chromium's very important because we're looking at if we have it is either diabetes or a blocked kidney. So we want to be very careful how somebody detoxes because if they're trying to do it themselves, they can actually affect their kidneys and liver. So we want to be very careful how to guide them, that if they're doing too much on their own and they are not aware of what they're doing internally.
This is one reason why personally it's me, my theory, I don't like IV chelation. That's just me. Because you have to really go back now and do lab work and balance everything out. And how do you know with the blood that it's giving you an accurate report to now put this back in someone's body? So it's always been my theory not to do IV chelation, either EDTA and they even have the calcium now. And they have the EDTA calcium, which I think will even sometimes cause more problems. So everybody can learn to disagree or whatever, but I know the people I've been working with based on your products, and since I've had this wonderful Oligoscan, they're doing so much better and feeling much better as well.
We do, for the chelation doctors, we'd like to have them watch this very carefully because those 5 minerals, the iodine, the zinc, selenium, and sulfur, and magnesium, we've seen them get zapped in somebody, and the doctor didn't know because they didn't have the Oligoscan.
Right, and they could have known right away instead of waiting for the lab report to come back. Not many people have an in-house lab to do this, and right now you'll know right now this very moment. So this is absolutely wonderful. Let me let you go on. Let me just go back to sodium. When a sodium is high, is it high because of dietary? Why would a sodium be high in a person who does the Oligoscan?
The sodium's high because we've got too much sodium in our food all throughout.
Well, through his diet, yes.
But the other reason why the hypertension a lot of people suffer from is actually from the aluminum breaks down as a salt within the body. And when it gets in as a salt, it actually is not able to allow enough of the potassium, the potassium for the cell, and at the same time, it's affecting the magnesium. So that's when we have high salt, it can affect the heart, the kidneys, and a lot of other things. So we like to get the sodium down by sweating. And a lot of people can't sweat enough because of the aluminum in the skin.
Okay.
It's also important to have more potassium than sodium because then your ratio is going to be balanced.
Exactly. And a doctor, he was a specialist in renal and hypertension years ago, said that the protocol years ago for hypertension was Lasix, years ago, Lasix and then potassium, not knowing that they should have just really had more potassium and less Lasix, because there you were pulling out all the fluid, but you wasn't giving enough potassium. And it was the potassium that was really monitoring the blood pressure, or helping the blood pressure to stabilize. And this is why so many medications are potassium sparing, so they make sure it's there. But when you take medication, anyone on medication should definitely have this test, because everything is going to be off balance with medication.
We see it all the time.
Yes.
But Lasix works internally, but to do something topically with the Herbalix products, we're able to put it on all night long, and because it's a stronger salt of a seaweed, it will extract the salt. So if you put it on your feet, the Herbalix nighttime deodorant, it helps reduce the swelling in the ankles. And when we see swelling in the ankles, we know the foot is not swelling enough. And then I've told many people, and I've seen doctors, the calloused heel tells me they're not getting rid of their salts.
And say that again. And on the bottom of your feet, you can just put it on. I've been so excited because people have called me the next day and said, I went to bed, especially during holidays, and they had a little bit too many things with sodium.
Correct.
And they put the
Detox
product,
deodorant, you're
the
correct.
detox deodorant on their feet, put their socks on, and the next day, and plus they had
swelling,
elevated,
yeah.
and it wasn't just the elevation. They said it was down so much better, and not only that, they felt better. Yes.
That's the way people used to sweat normally, but because of all our heavy metals, we're not able to sweat. But it's not only affecting the feet, it'll affect the knees. There's a lymph node in the knee that can get calcified on the inside. And I always have people palpate the inside of the knee, like when they put their knees together, there's usually a lymph node there.
So that would almost look like a person who have locked knees, but they
Right.
don't.
And
so
the
that's
mobility is
inside.
affected.
Right, and that's what you want to take your finger and kind of mash into that area, or press into that area.
And we usually use what we call cosmetically, the belly fat freedom. That's run up the whole leg. Now, they're diabetic, we cover the whole lower leg up to the knee. So we can get rid of the uric acid and neutralize the uric acid. But this works for everybody.
Wonderful.
But also that works on the hands. If somebody has a calloused hands, they're
Yes.
going to have this next lymph node right up, just like the lower leg. This lymph node can be affected.
Yeah, and it'll be tender. They'll press down and say, I have a little tenderness there. And it's funny, they don't notice it unless they press it. And because I've done that during the nutritional evaluation with the patient. And it works really good. A gentleman just yesterday was telling me about his hands, how, he said, my finger is constricting and all these things. Well, he forgot he was carrying these heavy, heavy bags against that. And then once he started using, it was two people. Once he started using the product, then he started doing a lot better. So, yeah.
Before we run out of time, I also want for the women out there that a lot of times they will be blocked by using a crystal deodorant or underarm deodorant.
And they think crystal is...
It's not safe.
It isn't.
It's absolutely not safe.
Keep in mind, now, if you or your teenage daughter or yourself or men or women, it doesn't matter. Those crystals are not safe.
Yeah. In fact, we've been able to trace that the underarm, the lymphatics from your gums go all the way to the underarm, but it goes through a lymph node area. There's a lymph node, and I always ask people, press here and see if there's any soreness. Usually,
Right across the chest.
Right across the chest.
Right across
and
the chest.
if there's pain, then we actually have them use the detox deodorant on the underarm, and then we have what we call the sentinel breast cream to run up to get and vasodilate that lymph node, because that lymph node is hooked up to the brain, the gums, and the thyroid.
Yes.
And we need to keep that open and the breast fluids drain they J up and come out. And we've had many people being able to, whatever was going on, because heavy metals have a tendency to get into the breast fat, the breast tissue.
Exactly. And so I want to say that, what are we doing for the men around the scrotum? The scrotum area for the men. Now, we dealt with the women.
Okay, let's
So
a
for
little
the men,
dip
okay?
for the men.
Okay.
So as we know, because the human race accumulates heavy metals, that the same thing we've been able to find in men. They suffer from these callous heels, callous feet, and then the knees. And when that lymph node in the knee gets plugged up, further up the inguinals in the leg, the thigh, then there's a buildup in the prostate because there's no place for those fluids to go.
Exactly.
And so they start to, and also the heavy meats, and because there's a lot of heavy metals in meat. And so we use what we call a product called Upright that goes in the pelvic area, and it helps to attract the from the prostate. We want to attract the aluminum salts that people have never examined it for.
And I have them put it also on the inguinal lymph nodes, and that's like in between the thighs. People sometimes would have inguinal hernias, and they kind of know where that area is. So you put it on the inside of the inguinal area, massage it in there, and go to bed, and let it work while you're sleeping. It is truly amazing.
And I would offer to say a lot of women have PCOS. They have vaginal issues.
Yes.
And a lot of them are related to the lower extremities being blocked. And so like edema of the
And
ankles.
we had a great show on PCOS.
Okay.
Which is polycystic ovarian cyst. That a lot of women have this. And I get calls all the time, and the doctors are doing surgery, and they come back. But you got to go to the root cause of the root cause.
Yes.
In order to get rid of it. It's not just the root cause anymore. It's the root cause of the root cause.
We looked at the literature, and the literature in those cysts, what fluids were hiding in there? There's aluminum in those cysts, aluminum salts, and they're trying to go someplace. And where they were supposed to go down the lymphatics to the feet, they're now finding the thin wall and the vaginal walls. So we can, if you see Dr. Lee, she can take care of this problem. She knows how to do this personally.
Yes.
We've discussed that. So, but that there is, for even detoxification in that area, for anything before an examination, I think it's critical for everybody to
Right.
keep
And
all
even
parts
before
of the
my
body.
surgery, even though the American dentistry in Tijuana, they do so many things. They're going to be coming on the show. But I actually had my product with me. So I actually did this the night before.
Correct.
And I'm still doing it, even though I had no mercury filling. But because, I was put to sleep. And it was amazing when they woke me up. They said, we're going to put you in a wheelchair and take you to your room. When I woke up, I said, oh, no, I don't need a wheelchair. Just give me another IV and make sure it has magnesium in it and my vitamin C. So the next morning, I actually felt wonderful.
And what's interesting is that the lymph nodes have to drain through the armpit. So when you were rubbing it up here, it was able to transfer all that bacteria and all the dead cells to the armpit. And people complain maybe a little bit of odor, but your lymphatics are now cleaned up.
Yeah.
And that's
try
why
to stay home for a couple of days while you're going through this, because once it's done, you don't have that type of odor. You don't have that type of odor. And if the body is cleansed, you shouldn't have that odor anyway, unless you eat a certain food like asparagus. Certain things are going to come through the pores, but then drinking a lot of water is so important in kind of flushing everything through. I want us to keep going through the report because there's so much in that report.
So we're down to, we talked about the chromium, and I'm going to, because there's cobalt and iodine. Let's go to iodine because of we could spend 4 hours talking about this.
Exactly.
The iodine is the most important that we think that we find that in Japan, we looked at everybody, their data for Japan, everybody who had taken a Oligoscan, and we found out actually they're very low on mercury, but they're very high in iodine because they always are eating seaweed. So we promote the kelp, any type of seaweed, to eat every day to counter the mercury. But in this particular person on this, their dentist and their whole family went to the same dentist. They have a leaky amalgams. So they really need to go back in, like you went in to have, a cleanup, because you need to have those removed.
Yeah.
And have something safely put in. So iodine, mercury, they counteract against each other.
Exactly. And your body is going to feel the difference. This is where those autoimmune diseases come in. And people think it's just, I need to go take all these immune modulators and do this and do that for autoimmune. Start with the base first.
Correct.
Look at the metals. Look at the metals first. Like I said, the root cause of the root cause. The root cause may be the metals, but what's happening? What is the metals causing? So
so the same thing is that if we go and when we look at iodine, the ones below that, the selenium and sulfur, are the two big factors when people detox, and they're retested again. So this person's selenium probably has, his arsenic may be a little high, but he doesn't have enough selenium, which you get in Brazil nuts. And you're able to bring up and so you need selenium to get rid of heavy metals.
yes, you do.
So it's just like the cylinders. If you don't have enough of minerals on board and you're blocked, you're going to have to start the lymphatic system, the skin, and once you get that sulfur moving, you have to replenish those minerals, and you have to come in and get another Oligoscan to see if you're doing it right.
You have to make sure.
Yeah.
This is something on an ongoing basis, because you get a baseline, and then you go ahead and start doing what you need to do, and then we come back again to see where things are going to. How are you moving through this? So we're going to keep moving down because we don't want to miss any of this.
And actually, I think we should.
We're going to skip to the metals.
We're going to go right to the metals because we think it's very important.
Yes, it is.
And so now we have the mercury and the cadmium, because cadmiums are used in amalgams also, along with silver. And you can see he's retaining all his heavy metals. And, you know, they're all, the barium probably was from the hospital because the contrast used in MRIs. We see it even 10 years afterwards.
10 years,
Yeah.
oh my goodness.
Yeah. And then lead can be from an old home, from the pipes. So, you know, even when we talk about, you know, Flint, Michigan, we thought they should have used the Oligoscan to test because the children are the end result, not testing of the water.
Yes.
Because there's variations all day long. We wanted to test, are the children retaining the heavy metals? But we found out in New Jersey, some of the schools in New Jersey had much more lead than in Flint, Michigan,
Yes.
and nobody was talking about that.
Right.
No, they weren't because we did a show on something similar to, yeah.
But here's another interesting thing. If we go down to the ratios, we'll show how much the influence on the potassium sodium, where this person had pretty normal sodium potassium, but when you put the potassium over sodium, it's in the red. That's because of the high aluminum and other heavy metals.
Yeah, so keep in mind, make sure things are balanced. And that aluminum, everyone I have tested, everyone, since I've had my machine for months now, there has not been one person that was normal, in a normal range of aluminum, not one.
There is no safe level.
There is
No.
no safe.
No.
And we tried to find somebody in 1,000 Oligoscans, the lowest aluminum we could go, and we found out nobody was low enough in aluminum, and nobody had enough magnesium.
Okay.
I mean, it's epidemic.
And
It is.
almost every one of them had the ratio off in sodium potassium as well.
Yes, I see that all the time when I do the test.
And most of these were practitioners and medical doctors.
I
That's
shouldn't
pretty
lie.
scary.
I know, because I did my test. I was not normal when I did mine, because stress has a lot to do with your minerals, and your heavy metal, especially your minerals. When you're under stress and you're working, you're not sleeping a good 8 hours a night. So there's so many factors that we factor in. So not to cut you off, but I just had a little sign here that we have a few more minutes to go. So I want to talk about a little bit more of the tests that the patient does not receive a copy of, but this is so important that they know these parameters. So you have it there on the screen. So let's kind of hit that a little bit, okay?
The physiology.
The physiology of this.
The physiology really is, and I'll let Liz mention on the minerals and heavy metals.
What's going on with physiology is the algorithm is including the influence of the heavy metal as well as the imbalancing minerals. And when you see the yellows, that means it's acceptable, but the numbers are still pretty low, and that's indicative of the world's population. All of
Yes.
us are facing the same challenges.
So we're going to say what those are quickly, too, because we don't have much time.
Okay.
You will be coming back again, because I think this is going to preclude, so many things going on in this world on so many levels. So let's say what they are.
Well, Liz,
And the enzymatic state, metabolism, cognitive function, tissue repair, cardiovascular system, intestinal assimilation, the immune system, hormonal status, emotional state, and the nervous system.
Now, all of those systems have to do with your minerals and your heavy metal. All of those systems. So if you look at all those systems, they're tied into everything. Cardiovascular is tied into MIs. It's tied into cardiac valves of the heart. When you look at emotions, it's tied into autism and all the other conditions as well. So when you look at the enzymatic, so tell me a little bit more about the enzymatic.
So let me mention also that zinc is going to impact the majority of the physiologies.
Okay.
And the algorithm for enzymatic includes zinc as well as iron, copper, manganese, and selenium.
Okay.
So if you see any of those are in low, especially zinc, then you're not going to get a good ratio for the enzymes. And this is an index that's close to the intestinal absorption. It reveals the functional status of the intestine, including its enzymatic balance. It's based on the algorithm that I just mentioned.
Okay, and let people know, what is an algorithm?
The algorithm is it's a mathematic equation that's taking into account each particular mineral and or the influence of the metal,
Right.
and the ratios of those to each other to see if you have enough or not any of the metals in
Right.
this case. So if they're in balance, then you're going to get a good ratio, and if they're not, you're going to get a lower one.
Okay. We're down to a few minutes. I want each of you to take 30 seconds and look at the camera as though you were looking into that person's eyes. And we start with your wife first. Elizabeth, what would you want them to walk away with in 30 seconds or less? Thank you.
I believe it's very important to realize that we're living in a very toxic world. And because of our environment and because of the food being depleted by heavy metals and all the toxins that are in the environment, that it is affecting our ability to get nutrition through our foods as well as our ability to get rid of toxins. And that's the influence of the heavy metals.
Wonderful.
And I will add that it lends itself, first of all, to get an Oligoscan so you know where your status is, and not to be afraid.
Yes.
Because you can change your life. You can set yourself up, because we know you have to detox every day. But you'll see the difference, and you'll feel the difference, especially if you change over to organic food and you make your house and everybody safer, because we don't want people ending up in a wheelchair. No. We want them mobile till the end of their life, and keep them out of hospitals. And anyways, before you see a doctor, you're gonna shower and wash and get cleaned up. You need to clean the insides up also. That is not well known. That is not, and we're hoping that this will get into the medical field, this approach, in the near future.
Well, we're all sitting here and we're all believers, and we know we're going to really meditate on that, pray on that, and that's going to happen. Because in order for us to heal and get well, we have to deal at a cellular level. We have to go into the DNA. You want to look at the mitochondrium of the cell, and you're not going to know what's happening at that level if you don't know about the heavy metal that's happening in the body, and you don't know about the heavy metal along with the minerals that are not balanced. Everything in our body have to be balanced. I would not be here today, a grandmother of 10, if I was not meeting wonderful people like you and learning about this new equipment. And actually, I practice what I preach. What I work with patients, and I don't want to say preach to the patient, but I'm a living example. And to me, we all have something. I've had all kind of conditions, but my quality of care is great. A little slower down today because I just had a 6-hour surgery, but I actually, even from that, I felt great. I drove all the way home. I felt absolutely wonderful.
Vibrant.
Now, it was hard to stop because this past weekend I did vascular screening at an expo, but I'm still going, and I still look, and I still feel wonderful. To me, it is your quality of care. That is so important. If you have no quality of care, you could say, everything in my body's balanced. I'm taking all this medication. I have a normal blood pressure that suppressed everything and caused some other off balance. But where's your quality of care if you can't get up and leave the house and go for a walk or go to a movie or play with your children or play with your significant other or have a great sex life? You know, all of this is going to affect everything. So it's so important that you take the time to have the test done. You know, I'm not pushing this, not a commercial. I just want you to be healthy and well. I want you to be healthy and well. So I want to thank my guests for being here today. I hope we covered a lot of information for you because you had a long trip here, and it's so important to me to have you in studio than on the screen because you're two vibrant people that I wanted people to see you. I really did.
Thank you, Dr.
And I
Lee.
thank you so much for coming in and being on the show. And until you're in this California again, I want to say, love each other as you always do. It shows.
Thank you.
That would keep you healthy in itself, loving each other. So it's so important to love each other and stay happy. So until we meet again next Wednesday, everyone, you know, take the time to love yourself, love each other, give yourself a hug. If you're by yourself and you don't have a significant other, Forgive, forgive, forgive is the number one key to heal. Forgive. Forgive yourself, forgive others. Give yourself a nice big hug and tell yourself you love yourself. Now, repeat after me. What do I always say? I am
I am
I am
so grateful
so grateful
to be a magnet
to be a magnet
for miracles.
for miracles.
And that's why I met you and Tony.
Meant to be.
What a blessed day. Everyone, we'll see you next time. Until then, have a blessed day. Bye.
Thank you, Dr. Lee.
Thank you.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.